Good morning, everyone. Thank you for attending. Today's webinar is the Medicare transition webinar. We're going to be going over the different parts of Medicare, um, different various items here. If we go ahead and scroll to the next screen. Okay. So with me today, my name is Ismail Pina, and also known as Ish, and I'm Assistant Benefits Manager here at Acera, and I assist the team regarding the medical, dental, and vision care, along with Medicare enrollments and the NBRP program. So with me today presenting, I also have Kevin Weller. Okay, he's our lead RBS over the retired unit, and our special guest from Kaiser, Yolanda Smith, and she would be also chiming in every now and then. And if there's any questions that need clarification with Kaiser, she will also be able to step in and help clarify items as we go through. Okay, thank you both for helping to present this today. Okay, so we're going to do a quick Medicare overview. We're going to talk about Acera and the Medicare mandate that Acera has. We're going to talk about Medicare, how it works, Medicare plan options, and of course, we'll be around for some questions. Okay. This item, today's webinar is being recorded, and it will be placed on our website for on-demand viewing later in the next few days. Okay. Next slide. Okay, so who is eligible for Medicare and who's involved? Well, it's typically people 65 or older, under 65 if you have a disability, okay? People who any age with ESRD or Lou Gehrig's disease, okay? Social Security Administration, and of course, the Center for Medicare and Medicaid Services, okay? So once you turn 65, everybody's eligible to go ahead and get their Medicare. The question is whether or not Part A is going to be free or not if you've done enough quarters. And we're going to talk about that in this process here. Part B, everyone pays a premium, and we'll go over that and show you how they come up with that premium that they would charge you. Okay, so if you're currently receiving Social Security benefits, okay, enrollment in Medicare's Parts A and B is basically automatic. So they will mail you your Medicare card automatically if you're already receiving a Social Security check. Okay, if you're not receiving a Social Security check, then and you're waiting to be a little bit older to apply to be able to receive a larger benefit. Okay, then we encourage you to give Social Security a call and inquire with them regarding your Medicare Parts A and B. Okay, that way they can go ahead and get the process and make sure that their records are all updated from you, and they can go ahead and advise you as far as what they're going to need you to do. Medicare Part B premium will be deducted from either your Social Security check or you can be direct billed. So typically for Medicare Part B, if you're receiving a Social Security check, they'll do the deduction right out of the Social Security check. If you're not receiving a Social Security check, Medicare will bill you quarterly. So it'll bill you for 3 months worth at a time. Okay. Your Medicare card will again automatically be mailed to you, and you'll notice it has your name, it'll have your Medicare Parts A, Parts B, and of course it has your Medicare identification number. They used to use their Social Security number, which I'm so glad finally after all these years they've switched to an identification number, which is great because if you ever lost your Medicare card, it's got your full name, it's got your Social Security number, and then of course your signature is on it. So that's a very important document you don't want to lose, because as soon as you get that, then you have your sensitive information, possible identity theft and so forth. Okay. So some retirees or dependents who are disabled may be eligible for Medicare earlier than 65. So again, Social Security would be the ones to deem whether or not your disability fits their criteria, and then they can grant you Medicare early. Next slide. Again, so if you're not receiving Social Security benefits, okay, then of course you still want to go ahead and reach out to Social Security at age 65 or just before age 65 and apply for your Medicare Parts A and B. Okay, so we want to start this process, I would say at least 90 days prior to your 65th birthday. Okay, that would give them time to process your enrollment there, get it approved, and go ahead and send you your card. Okay. So again, you want to call Social Security, and there's the number, that 800 number there. You can also go online to the website at medicare.gov to enroll in Medicare Parts A and B. Okay, Sarah's mandate. Okay, so when you or your dependent become eligible for Medicare, which is usually at 65, in order to continue being enrolled in our plan, you must go ahead and apply for your Medicare and transition over to a Medicare plan. You can't just stay on the standard HMO plans that we have. You have to go over to a Medicare plan. Okay. Currently, the carriers that we have with a Sarah plans that has the Medicare plan is the Kaiser Senior Advantage. Okay, that's the only Medicare plan that Sarah has as a group plan. If you don't want Kaiser Senior Advantage, then you would contact VIA Benefits, and they would assist you in enrolling into a Medicare plan of your choosing, if you like. That way, they can go ahead and get you enrolled, and through there, you can also activate your HRA health reimbursement account to get reimbursed. So we'll be talking about all that a little bit later. Okay. Next slide. Okay, so basically the Medicare mandate. Okay, so the Medicare mandate, basically, we're going to use a member who has 17 years of service, okay, turning age 65, eligible. So let's say, for example, this member is on the Kaiser HMO, okay, and these are the raised premiums for the next year, which is 2023. So Kaiser HMO would cost this person by themselves the premium is $909.74. This person has 17 years of service, so the 15 to 19 years of service MMA that Sarah was subsidized is $462.09. Okay, that leaves a $447.65 out of pocket net difference that comes out of this member's monthly retirement benefit. The same member becomes Medicare eligible, enrolls in our Senior Advantage plan. Okay, that premium is going down next year to $316.81. Okay. Anyone with more than 10 years of service is going to get subsidy. So this person is eligible for $316.81, and which leaves a zero out-of-pocket cost. So this $447.65 that's now coming out for them to have the HMO, that will remain in their check. So they won't have to pay that anymore. Their Senior Advantage plan will be fully subsidized. So they're going to see an increase in their monthly benefit, but they take home of that $447.65, so we won't be deducting that anymore. So that's going to save you quite a bit of money. It also saves, Sarah some money too, because now we're instead of paying out $462, now we're only paying out $316. So it saves you money, saves us money, and the benefits on the Senior Advantage plan are pretty rich. Your copays also drops down from the HMO, which is the $15 down to $10 in the Senior Advantage plan. What is Medicare Part A? Part A, it basically provides hospital insurance. Okay, it pays for Medicare approved hospital stays in skilled facilities, nursing facilities, rehab, things like that. So it's important, if you can, if Medicare Part A is free, then yes, you want to go and get it. And we're going to talk about that in just a quick second. Let me see the next slide. Okay, so basically, if you've done your 40 quarters, okay, of paying in, then basically Part A is free. Okay, if you haven't met the 40 quarters, then chances are Medicare is going to charge you a fee for the Part A. Okay, for 2023, you may pay anywhere from $274 on up to $506 monthly just to buy the Part A. Okay, if you don't get it for free. So you want to contact Sarah if SSA states that you need to pay for your Part A. Okay, but in most cases, if you choose to buy Part A, you must also have Part B and pay the monthly premiums for both. Okay, there is a late enrollment penalty if you don't sign up for these timely. So that's why we're trying to get you to understand you need to reach out and enroll prior to your turning 65. That way you don't incur any cost for a late penalty. Okay, so again, you may have higher premiums for twice the number of years that you could have had for Part A if you don't sign up timely. They do charge additional fees on their premiums if you don't do it timely. Next slide.
Hey, Ish, we have one question.
Sure.
And if you have your hand raised right now, feel free to unmute yourself and ask your question.
Okay, what's your question?
Yeah, so when I called Social Security just before I turned 65, they said if I had the right, amount of insurance through my employer, that I didn't have to sign up for Part A at that time, and I wouldn't be penalized for not signing up until I was ready to retire.
That is correct. And that's actually a slide that's coming up.
Okay.
Yeah, we'll talk about that. Actually, Kevin's going to talk about that in the next. It's like another 3 more slides. I'm going to talk about that.
Okay. Thank you.
Yeah. So and that's totally true. Yeah, as long as you're on an employer plan, okay, then you don't have to sign up for your Medicare. You can waive your Medicare until you come off that employer plan and actually retire. For those that are on an employer plan because they're still working. Okay, or if you're on your spouse's employer's plan, that's the same thing. You're on an employer plan. You don't have to sign up for your Medicare until you come off that plan. And because you had that plan, you're not susceptible to penalties. Okay. So, and again, just real quick, if you don't have the 40 quarters, you can also talk to Social Security regarding your spouse, because if your spouse worked and paid in the 40 quarters, there's a certain criteria. I believe if your spouse is at least say age 62 and they've done the 40 quarters, you may be eligible to get the Medicare Part A free, even though you didn't work all the quarters, based on the eligibility of the spouse. Okay, so that's something you'd want to talk to Social Security about. Okay, so Medicare Part B provides the medical insurance. Okay, it pays for a lot of doctor services, outpatient care, preventive services, diagnostic tests, things like that. Okay, things that Part A does not cover. And you do pay a premium. Everybody pays a premium for Part B. Okay, so for most Medicare eligible individuals in 2022, the Part B premium base amount was $170.10. Okay. In 2023, I did see that on the Medicare's website, they had that base amount is looking to be $164.90 starting January in 2023. Okay, so as far as Sarah reimbursing that, because we do have a program, and we're going to talk about that in a few slides. Right now, we do reimburse if you have at least 10 years of service or a service-connected disability. You are eligible to go ahead and sign up for Medicare Part B reimbursement, and we would put in an adjustment on your monthly benefit, giving you a credit of that $170.10. So basically, you're paying Medicare the $170.10 for your Part B, but in your retirement check, we're putting an adjustment credit of that same amount into your monthly benefit. Okay, so the board will be meeting in December, and that's when we'll be presenting them what the amount is going to be for 2023, so that they can approve. And as long as they approve, which they have done every year, then we'll go ahead and start reimbursing the Part B premium of that $164.90 in January. Okay, and enrolling in Medicare Parts A and B. And here's where I'm going to pass it off to Kevin. And Kevin's going to go ahead and present from here some slides. Kevin?
Thank you, Ish. Appreciate it. All right, so we've talked about the parts of Medicare, Parts A and B, and now we want to talk about, well, how do you enroll into Parts A and B? So if you're already receiving Social Security benefits, like Ish mentioned earlier, then you will be automatically enrolled and you'll receive your Medicare card in the mail about 3 months before your 65th birthday. Or if you have a disability retirement through Social Security, then it would be on your 25th month of disability. So the important thing there is if you're not getting Social Security, either you're not eligible or like Ish was saying, you're waiting to receive Social Security at a later time and collect a higher benefit, then you will not be automatically enrolled in Medicare Parts A and B. You will need to contact Medicare and initiate that enrollment process separately. We'll get to a further slide which talks about when you can defer enrollment into Medicare Parts A and B. And that's what Ish was talking about a moment ago in the question that we just had about if you're continuing to work on an employer-sponsored group plan, then you may be able to defer enrollment into Medicare Parts A and B until you lose coverage on that plan. All right, so how do you get started? So you can apply online at Social Security. So if you go to www.medicare.gov, you can start there. They have a Medicare handbook, which is really helpful. It's a good supplemental resource for this presentation. And I would definitely recommend taking a look at that and making sure that you fully understand all of the benefits that are available through Medicare and how the plans work. While you're online at www.medicare.gov, you can also enroll in Medicare. So that's the easiest way to do it. It's the fastest way. And also you'll be able to access your account online that way too. So you can also call Social Security, and we have the phone number provided there for you. And you can also visit a local Social Security office. The things to be aware of is if you call Social Security or if you go to the office, there are wait times. It really depends on the time of year and kind of what's going on for them that day. So again, the best way to do it is definitely online. If you're not comfortable with that, then you can call or go into the office. You can also schedule an appointment with Social Security. I think most offices offer that. When you are enrolling, you'll have to fill out an application and you can submit it in person to any Social Security office or you can mail it in. Again, if you do it online, that enrollment is electronic. It's an electronic form. You don't have to pay for postage. You don't have to drive somewhere, pay for parking or gas or transportation to submit that form. So definitely consider doing it online. So if you complete the application, you do need to make sure that you actually do get enrolled. So sometimes there can be issues with the application. You'll want to double check and make sure that that enrollment was successful. And they also, and Social Security as a part of that will be determining that you are eligible to enroll. So for instance, if you try to submit the application to enroll in Medicare Part B prior to age 65 and you don't have a disability, well, they're going to tell you that you're not eligible yet at this time. So you do need to keep out an eye for any correspondence from Social Security. So you may get that in the mail. You will want to double check though and make sure that it is actually from Social Security and not a solicitor and not a scam, because that's a common thing for things related to Medicare or insurance or any sort of health benefits. So just be mindful of that. You can always call Social Security if you're not sure if the thing that you're looking at is belonging to Social Security or belonging to Medicare. They'll be able to confirm for you. Next slide, please. Okay, so when you enroll in Part B, timing is really important. So there's a 7-month enrollment period, but what we really want you to focus on is the 3 months prior to the month of which your 65th birthday takes place. So when you turn 65 in a given month, your Medicare Part B should be effective at the beginning of that month for most people. And in order to enroll in Part B, it's a really good idea to get started on that process as soon as you're within 3 months. You have up until your birth month and then 2 to 3 months after your 65th birthday to complete enrollment. So if you're completing enrollment during your birth month or in the months following, you're already a little bit behind, and it's probably best to get going on that as soon as you can. So if you're listening to the recording now or you're watching the presentation and you haven't enrolled yet, but you've already turned 65, then go ahead and get started on that as soon as you can, unless you're already in an employer-sponsored group plan, which again, we'll talk about in just a little bit. So what happens if you miss the enrollment period? So let's say you miss the notification that comes through the mail from Social Security. Maybe our packet didn't arrive that we sent to you. If that happened and you missed it, then you can enroll later, and it's through January through March of each year. Your coverage would become effective on July 1st. And there's also a huge lifetime penalty of 10% for each 12-month period that you did not enroll in Part B. So it's 10% of the premium that you pay for Medicare Part B. So with that being said, you don't want to have a lifetime penalty. It's throughout your whole lifetime you have to pay that penalty if you enroll late. So you really want to avoid that if you possibly can. And this is the exception. So if you're determined working aged, which means that you are an employer-sponsored group plan, or if your spouse is in an employer-sponsored group plan and you're enrolled as a dependent on that plan, then you can defer enrollment up until the time that you lose coverage on that plan, at which time you would need to go through Medicare and complete their request for employment information. It's a special form that they have on their website that needs to be completed as soon as you know that you're going to be losing coverage on that plan. Send it to them. They'll certify that you were enrolled in an employer-sponsored group plan up until the time that you lost coverage and from the time that you turn 65. And then they will waive those lifetime penalties that are associated with late enrollment. Next slide. Okay, so if you are on that employer plan, what that means is you can delay Part B enrollment using the employer plan, and you can enroll in Parts A and B and have both Medicare and employer coverage if you want to. So when you're on an employer-sponsored plan and your most of those plans are going to be non-Medicare plans or HMO plans usually. So then you could potentially be enrolled in Medicare Parts A and B and have Medicare coverage, and then also still have coverage on that non-Medicare plan. So that's one option. The other option is to reject the employer plan. So like, let's say you are currently enrolled as a spouse you're currently enrolled as a dependent on your spouse's plan. If you want to, you could move out of that coverage. Turning 65 or becoming Medicare eligible is a qualifying event, and you can switch on to a Medicare plan. You could either come on to our Kaiser plan, or you could go through via benefits and select a plan that way as well. And that may be because you want different benefits. Maybe you want different coverage. So there's a few options that you have there when it comes to the employer plans. Hopefully that answered any questions that we had about that. All right. So Medicare Part B comes with a monthly premium, and the monthly premium is based on your income level. So what Social Security does is they look at the yearly income that you had 2 years prior. So you can see at the top of this table, it says if your yearly income in 2021 for what you pay in 2023 was, and then it tells you the different brackets for what you may fall into. So depending on how much money you made in 2021, your 2023 Part B premium will be based on that amount. So you can see the chart of what that is, and it scales up quite a bit depending on the amount of money that you made or what your income was during that year in 2021. One thing to keep in mind is that if you had a substantial change in income from 2021 to the next year, or maybe 2021 was a unique year due to inheritance or something like that, you can contact Social Security and request for an adjustment in the amount that you're paying for Medicare Part B. That's approved on a case-by-case basis. There's a separate process for it, so you would need to call them and check in with them on that. However, if your income hasn't changed much year to year, you're unlikely to get approved for any sort of change in the amount that you pay for Medicare Part B, which will be partially reimbursed through ACERA if you qualify for our reimbursement plan, which is really good news. Next slide, please. So speaking of which, we have our Medicare Part B reimbursement plan, or MBRP. So this is an awesome plan for everyone that's eligible for it. And if you are eligible, you should definitely enroll as soon as you are eligible for Medicare Part B, as soon as you get approved for that through Medicare. So this is a non-vested benefit, which is adopted by the Board of Retirement that annually authorizes the reimbursement of Medicare Part B to qualified retired members only. So with that, I want to put a little asterisk, because when we say the reimbursement of Medicare Part B, we are reimbursing the minimum amount that someone would pay for Medicare Part B. So as we saw in that previous slide with the income levels and the different brackets for depending on which income level you're in, you may pay more for Medicare Part B. It's possible that Acera's Medicare Part B reimbursement plan will only reimburse part of the amount that you're actually paying for Medicare Part B. So if that's the case, then you can understand why when you get that on your check after you get approved for Medicare Part B through Acera, it's not reimbursing you for everything that you're charged for Medicare Part B, because that is based on income, and we only give the subsidy amount for the lowest amount that somebody would be paying for Medicare Part B, or that top level of the bracket that we just looked at on the previous slide. So the current board approved monthly reimbursement amount for 2022 this year is $170.10. And on a previous slide, Ish showed you possibly what the new amount will be for 2023. And it may be a little bit less because the amount for Medicare Part B, the minimum amount for 2023 is slightly less. So, and that's what this next line says is in 2023, it's pending the Board of Retirement approval in the December meeting. So that meeting will happen in December. As soon as we have a resolution on it, we'll be posting that information on our website so that you can confirm what that rate will be. And if you're already enrolled in Medicare Part B as of that time, then you would see that change on your check at the end of January. Okay, so one really important note here is the non-vested benefit, MBRP, is not available for dependents, and it doesn't reimburse dependent costs. So the only person who is eligible for Medicare Part B are our retirees who have 10 plus years of Acera service credit or a service-connected disability. So when we say Acera service credit, what we're talking about is time that you actually worked for Alameda County and earned full years of service credit. So you can look at your letter that we sent you at the time that you retired, or you can call us if you want to confirm. We'll be able to let you know what your total years of service were when you retired. And the Acera service credit piece is really important because some of our retirees link retirement benefits between reciprocal agencies. For example, somebody that may have worked for San Francisco County and also worked for Alameda County may have, 5 years with Acera, 5 years of service, and 10 years with San Francisco. In that situation, they would not be eligible for MBRP because they have less than 10 years of Acera service credit. Now, if for instance, they had 15 years with Alameda County and 15 years with San Francisco County, then they would be eligible for the Medicare Part B reimbursement benefit with Acera, and they can enroll. Service-connected disability is not based on years of service. So if you have a service-connected disability, you may have more than 10 years of service already, or maybe you had less. And regardless of the years of service, you're eligible for the MBRP benefit. And then also you're eligible for our full MMA, the medical monthly allowance, as if you had 20 plus years of service. But it is important to distinct between the service-connected disability and non-service-connected disability. Service-connected is related to the job. The disability is more than 50% related to the job and happened during work, essentially, whereas the non-service connected disability is less than 50% related. And we have more information on our website if you're more interested about that, but those of you who have disability benefits probably already know which type of disability benefit you have. The other thing that is required is not just having the service credit, you actually have to follow a few steps. One of which is you have to prove that you are enrolled in Medicare Part B. And the way that you do that is you'll get your card from Medicare in the mail, and you will need to take a picture of that card or scan an image and send us a copy of it so that we can see your name, your Medicare Part B effective date to confirm that you are indeed enrolled in Medicare Part B. So in addition to providing that copy of the card, you also need to complete our Medicare Part B application form. So if you received a Medicare packet from Acera already, that form should have been included. It's also available on our website. You can download it, print it out, send it in with a copy of your Medicare card showing that Part B effective date. Alternatively, you can complete our DocuSign form on our website, which is at acera.org/forms. So if you complete our DocuSign form and you've already scanned an image of your Medicare card, you can complete the Medicare Part B reimbursement application form, and then you can attach your Medicare card image at that same time. So that's probably the best way to do it. That's the way that I would recommend to do it, is complete our DocuSign form. And that way you know that the card is attached to it and that you are enrolled in that program once we receive it. So this is a really important note, is it's not a retroactive benefit, which means that if you are enrolled in a Medicare plan, even if you enroll in Kaiser Senior Advantage and you've had it for a few months and then you contact us to enroll in Medicare Part B reimbursement, we're not going to go back and enroll you at a previous date. So it's really important that if you are turning 65 or you're becoming Medicare eligible, and you have Part B and you have a card that shows your Medicare Part B effective date, that you submit the Medicare Part B application and a copy of your card to Acera as soon as you can, so that we can get you enrolled in that program. Because if you submit it later, we can definitely still get you enrolled. It just won't go backwards. We're not going to pay a retroactive benefit for Medicare Part B reimbursement. And again, it's really important to note, it's not an automatic enrollment. You will need to complete the application and provide a copy of your card to get this extra benefit. One other note is this is what's considered a non-taxable subsidy, similar to the other subsidies that we provide for our insurance plans. So that means that you'll get the amount tacked on top of your check, but it's not taxed, which is a really great benefit. And one other note is you don't have to be enrolled in an Acera medical plan. So like the example I gave where you're enrolled in Kaiser Senior Advantage and then you enroll in Medicare Part B, you don't have to be enrolled in our Kaiser Senior Advantage plan. You could be enrolled through via benefits, or if you are enrolled through your spouse's plan, for instance, and it's both Medicare and you have Medicare Part B and you're eligible following those eligibility rules above about the 10+ years of service credit with Acera, then you can still enroll in Medicare Part B. You just still need to submit your application to Acera with a copy of your card proving that enrollment. And then after you do that, it's also a really good idea to double check. Look at your pay statement from Acera. Log into your Acera account online on Web Member Services and double check that you actually did get enrolled in Medicare Part B. And if you don't see it on your check, then call us and let us know right away. The Medicare Part B benefit will not be effective until the date past your Medicare Part B effective date. So if we're giving you a reimbursement, we can't reimburse you for something that hasn't happened yet. So for instance, if your Medicare Part B effective date is April 1st, the first day that you would see the Medicare Part B reimbursement on your check, if you submitted everything on time, would be at the end of April, when you receive your check at the end of April. Next slide. Okay, Part D, premiums by income. So Part B is for the medical insurance. Part D is an additional amount that you may have to pay depending on your income level. If you fall into that first bracket that we're seeing on this table with the income in 2021, then you will not be charged an additional amount for Part D. If you are making above that amount or made above that amount in 2021, then you will have to pay an additional amount on top of your Medicare premium. And this can come as a surprise. And the acronym for it is IRMA, I-I-R-M-A. If you have questions about it, the best place to read about it is Medicare's website, www.medicare.gov. You can also call them and talk to them about it. But just be prepared that if your income was in those categories, you will be charged an additional amount for Part D. Okay, next slide, please. Okay, so let's talk about the types of Medicare plans. first, let's talk about Medicare Advantage. So when we talk about Kaiser, our Kaiser Senior Advantage Plan, that's a good example of a Medicare Advantage plan. So it's assigned to a selected carrier medical group. In this case, that would be Kaiser. You select a primary doctor. Your doctor would need to provide referrals if you're going to see a specialist. And most Medicare Advantage plans have prescription Part D built in as part of the plan. So what that means is that you don't have to go out and purchase a separate supplemental drug plan. And you'll probably see commercials on TV. You'll get things in the mail about purchasing a separate drug plan, and make sure that you purchase a drug plan. The important thing is if you have Kaiser Senior Advantage or a qualified Medicare Advantage plan, then you don't need to go out and purchase a separate prescription drug plan. The important thing to note, though, is when we say that our Medicare Advantage plan through Kaiser includes Medicare Part D, includes the prescription plan, the important thing to note is that it is not paying for the Part D. So paying for Part D is between you and Medicare. And based on that last slide that we just looked at, there's a table that tells you how much you have to pay for Part D depending on your income level. So if you choose Kaiser Senior Advantage while Part D is included, so to speak, and you don't have to purchase a supplemental drug plan, it doesn't mean that your Part D will be reimbursed or that you don't have to pay for Part D. You'll still have to pay for that regardless of whatever Medicare plan you choose, either through our Kaiser Senior Advantage plan or through Via Benefits. With Medicare Advantage plans, copays vary. You must reside in the plan's service area. So for our Kaiser plans, it's Northern and Southern California. However, there are some areas of California that are not qualified for those plans. If you live too far away from a hospital, they generally will not allow you to be enrolled in those plans. And if you're ever not sure about whether or not your address is acceptable, if you're planning to move or something like that, it's a really good idea to call your carrier first, call Kaiser if you have Kaiser, and confirm with them to ask if the coverage is included in that area. And they will basically look it up by zip code. And if your zip code falls in the service area, then you're good. If it falls outside of the service area, then you'll need to select another plan, and that would be through Via Benefits. Okay, so that's what a Medicare Advantage, can we go back to that slide for just a moment? Thank you so much. That's the Medicare Advantage plan, and then a Medigap supplemental plan. So what is the Medigap supplemental plan? So it's different than the Medicare Advantage plan because you can go and choose it's not assigned to a doctor, and you can go nationwide to select your coverage. So what that means is that it's not attached to a medical group, and it's not based on a service area. So it's not restrictive based on zip codes. If you are, traveling within the United States and you need to see a doctor, then your Medigap or supplemental plan would have you covered in that state for any regular services that you might need. Whereas other Medicare Advantage plans might only have you covered for emergency visits and things like that. And it's based on any medical carrier that accepts Medicare. So not every medical carrier accepts Medicare. So what that means is it doesn't mean you can go literally anywhere you want, but most places definitely. And you can always check with the plan that you've selected, which doctors are available and where, and you can confirm, how you can go get your coverage and get helped. With these plans, you will need to select a supplemental drug plan. So in the example I gave for the other table, for our Kaiser Senior Advantage group plan, you don't need to select a supplemental drug plan. However, if you choose a Medigap or supplemental plan, you will need to select a supplemental drug plan, and that would be through Via Benefits. You can follow through Via Benefits and select a supplemental drug plan through them. Okay, and just like the Medicare Advantage plans, the copays will vary. Depends on the plan that you select. And of course, the United States is the service area. So if you're outside of the United States, that coverage is not included. Okay, next slide, please. Okay, so Acera-sponsored medical plans and individual plans. All right, so we have a few different options as far as non-Medicare plans. However, for Medicare plans, there's kind of two options. So if you're on non-Medicare plans through Acera, you either have our Kaiser Senior or Kaiser Permanente HMO, which is a non-Medicare plan. We also have United Healthcare Signature Value HMO and United Healthcare Signature Value Advantage HMO. Now, when you become Medicare eligible, or if you're a dependent on one of our retirees plans, then in that case, you will need to select either between Kaiser Permanente Senior Advantage or a plan through Via Benefits. So for instance, if you really liked United Healthcare, you can see that when you become Medicare eligible, we don't offer a group plan for United Healthcare. However, if you go through Via Benefits, there's definitely United Healthcare plans available. You just have to select a Medicare plan. The important thing to note is that if you go through Via Benefits, you are selecting an individual plan, which means it doesn't have the same group coverage benefits that are offered as of the plans that you're used to with our Kaiser plans through Acera or our United Healthcare plans through Acera. So the benefits will be different. And what you can do is if you want to compare the plans, you can contact United Healthcare or even Kaiser or other carriers, depending on what you have now, and ask them for what's called a schedule of benefits. And that will basically be a detailed breakdown of the different benefits that are offered under your current plan. So if you end up going through Via Benefits to select a plan and you're trying to figure out, well, what's the difference between these two plans, then you can compare the schedule of benefits to your current plan or from your current plan to the plan that you're looking at through Via Benefits. And you can always call Via Benefits to confirm which benefits are available. That way you make sure that you have, similar coverage if that's what you really liked, or maybe you don't need a lot of coverage and you just do your annual checkup for the most part, then you may not be as concerned about comparing the different benefits between the plans. So it's always a good idea to double check though. So those are the ones that are available. Next slide, please. Okay, so let's talk about our Kaiser Permanente Senior Advantage Plan. So this is what's known as a Medicare assignment or risk plan. If you are going to be enrolled in our Kaiser Senior Advantage Plan, you must be enrolled in Medicare Parts A and B. There is one caveat to that, and I'll mention it in just a moment. Acera has a mandate for Medicare eligible retirees and dependents who choose to be enrolled in an Acera medical plan. So that means if you're going to be on one of our group plans and you're over 65 or Medicare eligible, you need to be on our Kaiser Senior Advantage Plan if you want to stay with our group plan coverage. If you don't want Kaiser Senior Advantage, then that's when you would go through Via Benefits. So again, we were talking about the service area. So California residents residing within the service area. If you need to confirm the service area, call Kaiser Member Services and ask them. They'll ask for your zip code, they'll check their records and let you know whether or not you're covered in that area. So here's the premiums, which is also available on our website and also in our open enrollment guide. So if you were on payroll prior to September of this year, then you should have received a retiree enrollment guide included with our packet, which we send out for annual open enrollment, which has these rates as well as the rates of our other plans and based on different categories for MMA, the medical monthly allowance, our subsidies that we offer. So this information is available elsewhere is what I'm trying to say. So what are some of the benefits of the Kaiser Senior Advantage Plan? Well, as Ish said earlier, it's really rich benefits. This is an incredibly strong plan compared to a lot of insurance plans out there. Group coverage tends to have a higher level of benefits, and ours is one of the top tiers for coverage that you can have for a Medicare plan. So you have $10 copays for office visits. So actually that's a little bit less than the non-Medicare plan that we offer, which is $15 copays. The other benefit that comes with the Senior Advantage Plan through Kaiser, specifically with Acera's group's Kaiser Senior Advantage Plan, because there are different Kaiser Senior Advantage plans that are not with Acera, but our Acera plan does include the Silver and Fit gym membership, which last year was our first trial year in doing it, and all of our retirees that enrolled in it told us they loved it, so we kept it, and it's continuing for this plan year too. So we have a slide for that. I'll talk about it in just a moment, and it's a really awesome benefit that allows you to get free gym memberships and other awesome wellness tools through Kaiser if you're enrolled. So hopefully we can continue that as years go on, but it requires plan participation. So make sure that you subscribe to that if you do enroll in our Kaiser Senior Advantage plan. So let's talk about the eligibility for this plan. So as we said, you must be enrolled in Medicare Parts A and B. However, currently we have a separate agreement with Kaiser that says that if you have not paid for Medicare Part A, if you have basically if you worked less than 10 years in a position that did not contribute to Medicare, then in that case, you may have to pay out of pocket for Part A, and you can opt to not pay Part A and only enroll in Part B, and then you can still be enrolled in our plan. However, it's kind of a tricky situation, if you will, for this plan, because if you stop paying for Part A, or if you don't enroll in the first place and you only enroll in Part B, there's not very many plans out there that offer just Part B only. Our Kaiser Senior Advantage plan is one of them, and it's not guaranteed that it will always be that way. So it's a special agreement that we have with Kaiser to be able to offer a plan like this, but it does restrict you quite a bit if you don't enroll in Part A also, meaning that if you wanted to move somewhere that's outside of the Kaiser coverage area, you'd be forced to enroll in Part A, and now we're looking at some of those lifetime enrollment penalties that can definitely stack up over time if you do not enroll in Part A and Part B at the time that you are supposed to when you become Medicare eligible. So while the plan is available currently, it's not guaranteed that it will always be there, and it does limit you substantially if you do want to move outside of the Kaiser coverage area at some point. Maybe you want to move out of state, then you will have to eventually enroll in Medicare Part A and pay a lifetime penalty for that. So something to consider if you are going to go for the Part B only plan. Next slide, please. Okay, so Kaiser Senior Advantage, the Silver and Fit, Healthy Aging and Exercise Program Fitness Center membership. So it's with participating fitness centers. So not every gym is free, but there's quite a few, and should be some near you, hopefully. And with the free gym membership that you can get, you can work out, you'll get access to features such as saunas, pools, and whirlpools, depending on which gym you select. Obviously, not all gyms offer that. There's also special Silver and Fit classes like yoga, swimming, strength, and cardio training, flexibility, that sort of stuff. We also have some home fitness choices. So maybe you're not comfortable going to the gym, or it's a decent drive for you. So we have some home fitness choices through this Silver and Fit program. And you can get one home fitness kit per benefit year per enrollee. Correct me if I'm wrong on that, Ish. If you are the member and you also have a dependent, you both get a home fitness kit if you're both enrolled in Kaiser Senior Advantage. Is that right?
Yeah, it's based on the individual.
Based on the individual, so just the retiree, is that right?
Well, it's whoever, as long as you're enrolled in the Medicare Senior Advantage plan. If you're both enrolled, then you each can contact them to get your kit.
Perfect. Okay, that's what I thought. Thanks for confirming. And if you enroll in Kaiser, and then you get the Kaiser Senior Advantage or Silver and Fit benefit, then you also get access to digital workout videos that you can use for home workouts. So lots of really cool benefits that come with this. Again, if you are enrolling in our Kaiser Senior Advantage plan, we definitely encourage you to take advantage of this because it is totally free to you. Next slide, please. Okay. If you want to enroll in Silver and Fit, it's not automatic. So you do need to contact Silver and Fit, and Silver and Fit is a third party. So it's not part of Acera, and it's technically not part of Kaiser, but Kaiser contracts with the company that hosts the Silver and Fit. So if you end up calling and you're saying, hey, is this Kaiser's Silver and Fit? They may not identify themselves as Kaiser, and that's normal because they are a third party that offers this program. But they will be able to look you up, and they will be able to get you registered so that you can enroll and use those plan benefits that are associated with the Kaiser Senior Advantage plan. So you can either call, you can go on the website and you can look to see which gyms are available. And then you can also, through Acera, request for a gym to be added. So maybe there's a gym close to you that you think would be a good fit for this program, but you notice that it's not part of the Silver and Fit program. You can request for it to be added. Okay, so again, it's limited. We tried it for the first year last year, and we're glad that we're continuing it this year, but it is based on plan participation. We want, we need members to utilize this program in order to justify continuing it as part of our Kaiser Senior Advantage plan. So please make sure that if you are enrolled in Kaiser Senior Advantage, you do take advantage of this because health is of the utmost importance. So next slide. And I think I'm handing it back over to Ish to tell you more about the VIA Benefits Medicare plans.
Okay. All right. Well, thank you, Kev. All right. So VIA Benefits, for those who do not want to enroll into the Kaiser Senior Advantage plan, they can go over to VIA Benefits and find a Medigap plan or a Medicare Advantage plan through VIA Benefits. And VIA Benefits representatives, they'll be able to assist you to find a plan that's in your area. You'll be able to compare some plans. They'll be able to assist you with finding also the prescription drug plan. So when you call, because they don't have an office, so there's no face-to-face, it's all done over the phone, you want to make sure you have all your medications with you. That way you can have them run your medications through their prescription profiler, which runs it through all the prescription plans and then identifies what the cost would be for your prescriptions and what the premium is for that plan. That way you can make a comparison for yourself and choose which one would best work for you. Okay. Again, if a member decide to leave our SARE group plan and go over to VIA Benefits, yes, they can go ahead and take their dependent with them and also have them enroll into a plan over there. However, you guys want to do that, that's fine. If you are the retiree member, because you are the primary here with the SARA, so if you are on, let's say, for example, United Healthcare, and you choose not to go to Kaiser Senior Advantage, you choose to go ahead and go over to VIA Benefits to get a Medicare plan, you could do that. And if you have a dependent on your United Healthcare plan with us now, then they can go transition with you, or they can go ahead and jump onto our COBRA plan. But the COBRA plan will only last for 36 months, and then they'll have to find coverage elsewhere. So again, you can move over to our Kaiser plan or move over to VIA Benefits. Okay. And only the retiree is eligible to submit claims to the health reimbursement account. Okay. Out-of-pocket expenses for dependents are not reimbursed. Next slide. Okay, so you can go online there. You can give them a call. You most likely you'd probably go ahead. They'll get you to make an appointment. If they can't get you to a benefit advisor, a licensed benefit advisor at that time, and that way they can go through the call with you to get enrollment done. Okay, so the carriers, again, on the individual side, they do require both Medicare Parts A and B. Okay, Medicare Advantage plans typically have Part D, which is the prescription coverage built into it. Medigap plans or supplemental plans are medical only, so you need to get enrolled into a prescription Part D prescription coverage to cover your prescriptions. They will assist you to do that. Again, a licensed benefit advisor will go over the plans available in your area. Plans are nationwide, so wherever you're living, you can go ahead and enroll into a plan. They'll find you something to enroll into. Supplemental plans and Medigap plans are nationwide. It's in itself, so it doesn't matter where you live throughout the United States. If you enroll into Medigap or supplemental plans, then you have coverage nationwide. Okay. Reimbursement available for retirees. Oops. Okay. And for your out-of-pocket medical expenses, prescription drug plans, premiums, copays, deductibles, anything that's medical necessary. Okay, medically necessary. You can set up auto pay. You can also get direct deposit available. So, for example, you have a claim, you can get that direct deposit back to you. So instead of having a hard check mailed back to you, you can have that set up as a direct deposit. So your reimbursements get deposited back quickly to you. Okay. The premium, typically your premium is the same every month, so you can always set up auto pay. So submit the necessary documentation, and it shows that, hey, this is my premium every month, and so forth. And then you can set up for auto pay to get that automatically reimbursed back to you. Okay. So your reimbursements for the current year must be claimed by March 31st the following year. So for example, anything that's now in 2022 for services or out-of-pocket items that you have, okay, at the end of the year, whatever balance you have left in your health reimbursement account will get wiped out and to zero, because as of January 1st, it's such a new benefit year over on the benefit side. And so you'll get a new benefit for your health reimbursement account for the new 2023 year. Okay, so anything that if you still had a balance out of your 2022 HRA account funding, then you have until March 31st of 2023 to submit for anything that was still in 2022 to be reimbursed out of the funds that you still had available out of your 2022 funds. Okay, so you still got some time to get that processed accordingly. So online health reimbursement account tracking and status updates. If you created your login at the VIA Benefits website, you can have your login. You can go in and check the status of any claims, things like that. You can download claim forms. There's lots of stuff you can do. You can always go in there and check your balance as far as what you have left in your health reimbursement account. Okay. Next slide. Again, the prescription profiler, this is the item that I had mentioned just a little bit ago. So prescription companies, they add hundreds of prescriptions every year, and prescriptions tend to change from one tier to another. So the one thing that members tend to do, they get into a medical plan and they're good to go with that. But it's always good to check in with VIA Benefits and have them check your prescriptions against in the profiler against other prescription drug plans to see if there's any changes, if there's a plan that you can get into for your prescriptions that's going to be lowering costs for your copays and lowering costs in your premiums to help save you some money. A lot of times it'll still be the same plan that you're currently in. It may still be the best plan. So you can always just at least check in just to be sure. And if so, then you go ahead and stay with your plan. Otherwise, you can see and compare for a different prescription plan and then switch over so that you can save some money. Okay, so open enrollment, as you guys all know, right now during the month of November is our Sarah's open enrollment for the whole month of November. However, open enrollment on the individual side to VIA Benefits, okay, that started October 15th and will run through December 7th with the elections of which you select to enroll into effective January 1st. Sarah's open enrollment is only the month of November, and our plans begin February 1st, not January. So if you're changing over to VIA Benefits, then your new plan on that side should begin January 1st. Okay, because that's the new plan year. Again, one's monthly retirement allowance must be sufficient enough to cover the elective healthcare plans. Okay, we can't have you going into a negative negative growth situation where your premium is larger than what we can deduct or can be deducted or paid out of your benefit. Okay, so again, as far as the monthly medical allowance and the premiums, the items that for the HRA allocations. Okay, so the top chart shows what the Sarah Group Plans MMA is, okay, and also shows the pre-65 or non-Medicare HRA amounts, okay. So as you can see, they've been increasing, and this year the board did vote to allow us to increase what we subsidize. So this year's MMA for someone 20 plus years of service or service disability increased from the $996.73, it increased to $616.12. Okay, and for 15 to 19, it increased to $462, and the 10 plus is $308. Now, when you're in the Medicare plan through VIA Benefits, your subsidies are a little bit lower. The HRA funding for a 20 plus or service disability person is $471.99. It goes down to $353.99, and then of course the 10 to 14.9 months is $236. Now, members call us all the time. So, well, how come my benefit reduced down from the what I had before just because I became Medicare eligible and enrolled into a plan to be a benefits? Well, one of the reasons for that is because the plans on the individual side, okay, when it comes to Medicare, those plan premiums are much, much lower than the non-Medicare. Okay. For example, just to give you an example, I got some members who are in Medicare Advantage plans in other states, and they are only paying like $39, $58, something that's really low. Okay. So, though there's funding in your HRA accounts, and a vast majority of members never use up all the funds that are in the HRA account. So although these amounts here, okay, on the Medicare side is lower than what you would if you were on an ACERA group plan, those members never tend to use up all their allocations that we place into the health reimbursement account. Okay, there's very few. I would say I probably count them on my hand as far as how many people actually run out of those funds, and it's usually because because of their ailment, they're on a specialized compound medication, which is very, very expensive, and so the cost eats up their balance pretty quickly, and they tend to run out usually around October, November. They run out if they're on that one of those specialized compound medications. Okay. Qualifying events. Okay, so loss of coverage, relocating out of the service area of your plan, a service annual open enrollment, becoming Medicare eligible is a qualifying event, which is why we have you here now talking to you so you can make a good choice and transition over. Retiring after age 65, marriage, a new domestic partnership, and of course, divorce. All those qualifying events. Okay, again, once the person retires and we set up direct deposit, they tend to vanish. So it's always good to let us know if you're relocating somewhere, to send us an address change. One of the reasons is, there are some things that we do need to send to you to advise you about certain things. So I remember several years ago when the county disconnected and dropped the contract for one of the other providers that we don't offer anymore. We tried to notify members, but because they've never updated their address with us, they didn't find out that, hey, my medical coverage doesn't exist anymore because that contract is terminated, but we weren't able to get a hold of them until they finally tried to go get services, and then they realized the coverage is bad and they contact us, and then we're able to get those resolved. But that's a good example as far as making sure you're keeping your address with the ACERA current, because we do need to get a hold of you at times for certain things that are very, very important. Okay. So if you're moving out of California, make sure that you complete a state tax form, because you don't want to be living in another state and getting a state tax letter from California regarding taxes and so forth. Okay. So remember to send the ACERA a completed address change form, which can be found on our website. All right, that pretty much concludes everything. So you can email any questions that you may have. If you have any questions, sometimes you'll have an event that you're watching like this, and you may not have questions until later on. So, oh, I should have asked this question. Well, just simply go ahead and email your question to info@acera.org, and one of our ACERA representatives will be able to respond to you and provide you the information you need. Okay, we're always ready to assist you, and this recording will be posted on our website in the next few business days. Okay, you'll be able to go to that web link right there, acera.org/videos, and view the necessary any of the videos that we've done in the past.